Hey, this is Dr. Scott Hoar from Alcoa Chiropractic Center, and today I wanted to show you how we're using Kinetisense 360, a markerless 3D motion assessment tool to help treat our patients, but it's really helping with patient education too. So I want to show you a couple of cool things. So it's an app on our iPad. Here it is, Kinetisense. We really had a cool experience with one of our patients. She had come in, she had chronic, I believe it was right hip pain, right in kind of the hip flexor, as well as kind of external rotators. She had some chiropractic care for a number of weeks and months, and it still just wasn't resolving. So I referred her over to our physical therapist, and he did a great job of kind of understanding where she had shortcomings and giving her proper exercises. We got about 8 or 10 visits into her treatment plan, and it just wasn't quite resolving the way we want to. So then what we did was we came over here to Kinetisense and we started assessing her movements. You see all these angles that the Kinetisense is able to pick up? It's markerless tracking, which is incredible technology that it's able to tell what's going on. So that's specifically what we were looking at, was the step-ups, because that's when she could feel it. Now, if we want to sit here and look through how she moved, when she extends here, you'll see the left leg is extended. And I really like the angles right here between her ankle, her knee, her hip, and her spine. They're very much aligned, and it looks clean. That's how we want it. But look at all these measurements. You'll see right hip flexion is at 143. Right knee flexion is at 86 degrees. 2 degrees with the spinal angle. Very, very cool stuff that the Kinetisense is able to pick up. Look, she's got a 27-degree forward head tilt during that exercise. That might be something we'd want to address. But the big thing, the elephant in the room with her, was when she does extension with the other side, look what we see right here. The right knee is still bent. Instead of 180 degrees of flexion, we're at 166. We've got 116 degrees of hip flexion. The spine angle is extended back at 8 degrees. So we are absolutely not in that triple extension position that we really want to know that she's moving with good mechanics. Now, here's where this matters. The physical therapist was aware that this was going on the whole time, and whatever word choices he was using just didn't communicate with the patient. Once we were able to sit here and show the patient exactly what was going on, it all clicked for her, because she's a Pilates instructor. She knows her body pretty well, and as soon as you showed her the swaying back of the hip here and how the knee wasn't quite locking out, she was able to change that. She started locking out the knee, engaging the core a little bit better to get that triple alignment that we really want to see. But how amazing is this Kinetisense tool that it's able to pick that up? And not only are we able to figure it out from a clinical perspective, but then the patient education is that much better. So now we're going to end up getting better outcomes.
Well, it was interesting because I thought I understood what the physical therapist was telling me to do. I thought I was doing it. And obviously I wasn't, but I couldn't feel it. Once I saw the pictures and saw the movement in action, I could tell I wasn't moving the right side the same as my left side. And then for me, the cue that I needed to follow to align everything was to pull up, which he would have, I don't know, that word wouldn't have happened if I hadn't actually looked at the pictures. And whatever the word choice is, I saw what I needed to do, and I did it, and it made all the difference in the world. Well, long term, my hip is great, and I know what to do when it starts to get weak, or I start to experience that hip pain again, or wonky walking, and it just works. I actually haven't had issues in a long time.
So as you can see, it actually makes a difference for the patient. The patient experience is better. The patient outcomes are better. So I think that's a really powerful technology, and I'm excited to use it going forward. If you're interested in the Kinetisense, check out the link below in the description. This is Dr. Scott Hoar from Alcoa Chiropractic Center in Tennessee. Have a great one.